Hi, I'm Don Carswell. Come into Dublin Nissan this month and buy a new Nissan and pay 0 interest for up to 7 years. And don't forget our second annual 12 Days of Christmas. Wishing you a Merry Christmas and a Happy New Year from Dublin Nissan.
It's nothing personal. It's just business.
Hello?
That's how some people do things.
Right away.
To us, everything we do is personal. Because anyone can answer the call. It's who shows up that matters most. That's the quality of your independent agent and the company that stands behind them.
Ask Curry Maffett Insurance in Dublin if auto owners make sense for you.
Okay, so Doctors for Everyone, would you state for us, first of all, Dr. Hirsch, your name and...
Hi, I'm Dr. George Harrison, Chief Medical Officer, Fairview Park Hospital.
I'm Dr. Don Nelson. I'm an infectious disease physician and a hospitalist at Fairview Park.
Yes, you probably, Doctor, been answering a lot of questions lately, haven't you, from the public?
Yes, we have. I think Dr. Harrison and myself both have been answering a lot of questions, and both from the public and also from hospital employees.
Yeah, and from the community, I know that it's evolved. What questions have been asked has evolved greatly, and now everyone has been waiting for this day for so long. I can understand why you were chosen to take the serum first. Doctor, what about you?
The number one question is, will you take it? And you just saw evidence of that. I did take the shot. Dr. Nelson took the shot, as well as many of our colleagues who were to follow us. We feel very comfortable with the data. We recognize that getting this vaccine is our first way to get this pandemic up under control.
Dr. Harrison, how long ago did you find out? How long ago did you find out that you would be getting
the vaccine?
The vaccine.
We got notification about 24 hours ago. We registered some time ago when the state of Georgia asked all hospitals to register, and we received notification of the injection kits, and not long after that they said, please expect the vaccine within 24 to 48 hours.
Dr. Nelson, what questions are people asking you now, since we know that the vaccine is out and it's already here in our community? What are people have been asking you in the last few days, and what do you think people's opinion should be now as far as getting the vaccine?
Well, let me second what Dr. Harrison said. The first question is always, will you take it? There's questions about the safety, and do I feel comfortable with the vaccine, since it's a different type of vaccine than what we're used to in the past. Questions about the potential adverse reactions and side effects. And of course, in these days of social media, all of the conspiracy theories and sterility and just everything you can think of. But thankfully the science is there. The data presented last week by Pfizer to the FDA and also Tuesday by Moderna to the FDA, I think is very clean, very nice science, and it tells us that these vaccines are safe.
Dr. Harrison, what's the handling of the vaccine? We'd have understood that, and there was speculation, who's going to be able to afford to be able to house it? How do we get it? How long does it have to stay cold for, when you bring it out? Because we see it here, you have it in a vial and you just take it out into the syringe, into the needle, and then into the arm, within a few minutes.
Yeah, Pfizer has developed a very ingenious way to send this vaccine out. It is packed in dry ice. It's kept at a controlled temperature of negative 70 degrees Celsius. We have the capabilities to store that on site. A lot of hospitals do have that capability. Once the vaccine is taken out of the storage and put into a refrigerator, you have several days before you can give it. But once it's reconstituted, then you have a certain period of time that it must be used.
What would you say to the public about how to handle this? Because there's going to be an influx of phone calls. There's going to be people that desperately want this vaccine.
Well, we like to encourage the public to, yes, start reading about this vaccine, speaking to your physician about this vaccine, speaking to us, as you see us out in the community, about the vaccine and how it can help to control the pandemic. I would say to the public, once it is made available, please sign up with the local health department, with your local PCP office, and be a participant in getting this to control this pandemic.
Dr. Nelson, would you speak to us on the protocol of who should be getting it first, how it'll all be handled? Because we've seen several stories, and you're truly an expert on infectious diseases, so share with us.
Well, it's my understanding in the state of Georgia, the plan is initially for frontline healthcare providers and those at highest risk, which will include nursing home patients, people in assisted living facilities, extended care facilities. Somewhere in that list will be included inmates in the prison system, because they certainly are at high risk, and if the disease runs rampant through those systems, then it puts a huge strain on hospitals. So they are certainly a priority. And then those individuals who are just at high risk because of other medical conditions, whether it's renal failure, diabetes, other issues. So there will be some prioritization done, but hopefully between the two big players that are going to be available now, there will be sufficient vaccine for these first few months.
Doctor, if you can answer the question, what do long-term facilities do? Have they been contacted by the government? Should they reach out? What's their protocol? If we have loved ones in there, I know we're all concerned.
I know locally, Dr. Thomas Kraft with the Department of Public Health has been in close contact,
Correct.
really for a number of months, working with nursing homes and other extended care facilities through all parts of this pandemic. And so they already have a very deep-rooted relationship, and I'm sure those arrangements are already in the works or on paper.
I would confirm that Dr. Kraft has been in contact with the state authorities, and they have a defined plan as to how they will disseminate this vaccine out to the long-term care facilities.
Once one is tested positive with COVID, the vaccine is not any good to them, is it?
That's not true. I mean, really, I think the party line is going to be, certainly my recommendation to the people who have asked me is, if you have tested positive, if you've survived COVID, then there will be a period of time, and I've read two different numbers, one is 14 days and one is 90 days after your initial infection, that you are a candidate for the vaccine, and the vaccine will offer some benefits that you may not have received by being infected by the wild type virus.
If one has the COVID virus, the vaccine won't help them at that moment, but it will help them from being reinfected, you're saying?
It is the opinion of the experts in the field is that it's going to offer some benefit over just the wild type infection. Mm-hmm. And certainly the data I read makes me believe that's to be true. And I think yes, I would certainly do that if I'd been infected previously.
Okay. And what is the schedule? Is it 21 days and you take another vaccine?
It depends on which vaccine it is.
Correct.
Pfizer is today, and then I'll take another one in 3 weeks. The Moderna, when it comes out, will be day one, and then 28 days later.
Right.
You know, it's Johnson & Johnson is trying to develop a vaccine that'll be a one-shot deal, but they're probably next spring.
Right.
And so this is what we have available now, 2 shots. You know, the first shot will offer some immunity, but I certainly would not rely on it. I would certainly have that second injection.
Absolutely. The studies did show that the second dose is just as important as the first in terms of, having overall effectiveness in preventing the disease.
Could you all project when you'll be treating everyone here at the hospital, and then when it would be available for community members who are healthy, just don't want to, take the chance of getting COVID?
Well, I tell you, the hospital core, those on the front line, have done an amazing job from the moments we first started seeing this disease, this virus, up until now. Dr. Nelson has led the foray into fighting it all. We want to make sure those who are on the front part of the line, those who are in the trenches day in and day out, receive the vaccine first. And then we will follow in terms of highest exposure to least as to how we administrate this. You think about obstetricians in the community who are having to deliver women who come in and they're in one of those high exposure categories. You think about surgical specialists, you think about emergency room, hospitalists, lots of different specialties. You think about nurses, respiratory therapists, all those on the front line. We want those who are in the rooms day in, day out to be the first ones to receive this. And then secondarily, we will roll this out. It has been reported that the community may receive this the first part of spring, late winter, early spring, but it's unknown. I know they are trying to ramp up production of the vaccine so that everyone can get this. Moderna will help tremendously.
Dr. Harrison, how exciting is this day for you?
Extremely, extremely. We, I think in healthcare, you will see when we heard that it was released for use, there was elation that filled the room because we know, as being scientists, that this is our first step toward controlling this.
Dr. Nelson?
I echo what George says. I mean, really, throughout history, any viral pandemic has really only been controlled by vaccination.
Yeah.
You look at smallpox. Smallpox in the last 200 years has killed more people than all of the wars of mankind combined. Mm-hmm. But yet, smallpox doesn't exist. And it's not because of social distancing or mask or gloves.
Vaccination.
It's because of vaccinations.
Absolutely.
There are childhood illnesses. You know, if you're 10 years older than I am, you grew up in fear of polio. People today don't know anybody with polio. And all of this is vaccine related.
Quality products and installations since 1985. That's 4 Seasons.
It's really hot outside, and the deals are even hotter with the City of Dublin Natural Gas. How would you like a free 40-gallon hot water heater plus free gas installation? It's easy. Just pick up the phone and call Brad Grimes with the City of Dublin Natural Gas, 277-5048, and get a free hot water heater and free installation. The City of Dublin Natural Gas, saving you money every single day.
At Lakes Alignment, we would like to take this time to thank our community for your support over the last 66 years, and especially these last few months with the opening of our brand new truck center. When you drive into Lakes Alignment, you get master trained technicians like Anthony Penny. Everybody calls him Bug, but it means so much to us. And on behalf of Neil Harden, Lisa, our staff, and the entire Lake family, we thank you for supporting us since 1954. Come see us today. We open every morning at 8 o'clock, and now our truck center is open on Saturday to serve your big trucks and equipment from 8 until 12. At Lakes Alignment, we thank you and this entire community, and will continue to serve you with the best trained staff and friendly, courteous service. Lakes Alignment, Hometown people serving hometown people. Come see us today, 104 Johnson Street, East Dublin.